Two of the 6 health workers who contracted Ebola while on duty at Mubende Regional Referral Hospital have lost the battle. The latest being Margaret Nabisubi, an anesthetic officer. Minister for Health, Dr. Jane Ruth Acheng, says all is being done to ensure the rest recover. They are being treated at J-Medic in Fort Portal.
Our partners have brought in drugs, trial drugs. We have remdesivir, which is being given to them. We have monoclonal antibodies that is being given to them. We are even trying convalescent plasma for all these patients.
However, Dr. Cheng says she was disappointed by some comments made on social media over the matter.
I see very funny tweets on social media, some of them from the president of Uganda Medical Association, who has never even entered an Ebola isolation facility. And he talks like that to discourage his own colleagues. Very unfortunate. The ICU equipment he's talking about is available. But how do you start putting a person who is bleeding and has Ebola and you try to intubate? You spread the infection even further. So they are giving them oxygen using all kinds of methods.
The minister spoke after receiving an assortment of items donated by the World Health Organization and USAID to help in the Ebola response.
As you have heard, this kit can go on for 10 days. When you look at it, it looks small, but there are many wares in there for the health workers to put on and enter into the isolation facilities.
Additionally, the World Health Organization has released $2 million, approximately 7 billion shillings, in emergency funding to support Uganda's interventions against Ebola. Meanwhile, in Fort Portal, preparations are underway to bury the late Nabisubi.
We are making arrangements to see that she's buried safely in Mitiana, where she comes from. We expect to have this burial conducted today.
There has not been any new Ebola cases in the last 24 hours, and the disease has been detected in 5 districts so far: Mubende, Kagadi, Kasanda, Bunyangabu, and Chegegwa. Walter Mwesije, NTV.